This is the final strategic panel. It's about bringing the VHT to society. And similarly to the last strategic session, we have an opening keynote speaker who's going to present for roughly around 15 to 17 minutes. There'll be a time for a question for them, and then we'll have 4 panelists who will talk about their work for about 5 minutes, and then we'll hopefully then after that have a very nice discussion. So without further ado, I'd like to bring on stage our keynote speaker, and that is Sinja from the University of Latvia. So let's give Sinja a very warm round of applause. Welcome.
So good afternoon. I have this toughest task to speak in the last afternoon after the lunch. So I hope I will manage. Yes, my name is Signe, and I'm from University of Latvia. My field is empirical bioethics, so I work with both quantitative and qualitative data to look into ethical issues. And last decade, I have worked mostly with biobanking, genomic data, some other issues, and new technologies. And also recently, I have been involved also in digital or virtual twins field. So when looking at the topic, it's very broad. It's about VHT and society. I chose the title Navigating Ethical and Societal Challenges in Bringing VHT to Society. And I will start with a little bit bird's eye view on the ethical and social problems involved in VHT field. And then I will look at some empirical data about societal attitudes in Europe and try to show how it applies to VHT and EDITH. Let's start with ethical issues, and not to invent something new, I looked at the paper which was, I think, very good paper published a couple of years ago by Popa and colleagues, and they, based on qualitative data on discussions, focus groups, and interviews, they have mapped the ethical and social problems in the field. They use the term digital twins. And as you see, there are the positive side on the left, and some risks and questions on the right side, and nothing. I think almost nothing new which wasn't discussed during these days. We see many benefits, and you are the most important to see those benefits and move forward in direction of benefits. But then, of course, there are some questions regarding data safety, no surprise. Then maybe it wasn't so much mentioned. This second topic is about patient-physician relationships, which is much more philosophical, but we can ask how digital twin might influence patient-physician relationships, what we should implement in the education of future doctors, and how not to find ourselves in a situation where doctor pays much more attention to the digital twin than to a real patient, so it might be challenging. And then, some other risks, including environmental risks, but I will speak about that at the end. So I have 3 examples here, and again, they were, I think, all mentioned during discussions yesterday and today. One issue, as we see, is, for example, quality of informed consent, which is a never-ending topic in all fields of medicine and research. But the devil is in details, as always, and the open questions are how to ensure valid, voluntary, and adequately informed consent, both for research and clinical use of VHT. And I think it wasn't mentioned, but recently a big topic is how to involve AI in the process of obtaining informed consent. So maybe it's worth to think about that and discuss. There are some cases where it might be fruitful and some cases where it might be dangerous, as always. Then dynamic consent, we know a dynamic consent very well in the biobanking field, and there are some ideas that maybe in the field of VHT, dynamic consent might be useful. Personal data protection, maybe I will not take a big time for this, because this quote from a very good article again by Iqbal and colleagues, it speaks about anonymization and de-identification, and it's clear that nothing is clear in that field. We hope on better guidelines next year. We know that the European data protection authorities are working on this issue, but still, it's very, very complicated question. And it was just discussed in previous session about responsibility and liability. And maybe it's still not so easy that we all know what responsibility and liability means. I somehow feel that in case of virtual twins, there are some new questions when we try to implement digital twins, and there are unclarities about who is responsible for what in the whole process, and who can be held liable. So maybe it requires some further discussion. But now I know many of you work with data, and therefore I took some data, and let's look at data, what EU citizens think about science and new technologies. And I also tried to somehow reflect what does it mean for VHT. You know that one of the very good sources of societal attitudes is Eurobarometer. And what I did, I looked at the latest Eurobarometer, which is about science and technologies. It's 2021. And it was COVID time, and we all know that COVID changed a lot in attitudes towards science. So there are some good news. I think this is a good news that the influence of science and technology on society is overwhelmingly seen as positive in this 2021 barometer. So scientists are the good guys in general. And of course, nothing is so easy. You see the differences between countries, but though there are not so much differences between countries in this question. But I think interesting is this profile about who says or who has this positive view, and respondents who left education later than people who are managers or people who score highly in the quiz. Quiz was about respondents' knowledge about science. There was a quiz also. So there is a specific group. But then maybe not so good news. I think this is an interesting question. In 18 member states, 50 or more of respondents agree that they have no option but to trust those governing science and technology, which poses questions about distribution of power, and at the same time, it poses this huge question how to build trustworthiness. Because in the previous panel, I think it was very good discussion about trust, but I think that even more, it's a question how to build infrastructures or how to build practices which are trustworthy. Then the power question, and in 12 member states, 50 or more of respondents agree that because of their knowledge, scientists have a power that makes them dangerous. That's interesting, isn't it? And I think in the context of VHT, it brings up the question which was quite often discussed during yesterday and today, how to empower patients in the context of VHT, because I think that the only option to balance this is to give more power to patients. The problematic issue is to answer what does it mean to empower, or what empowerment means in this context. Because not always empowering means to give all means into hands of the patients or society. I don't know, it's not the best idea to give a scalpel to a patient to operate himself or herself, or we have seen that direct-to-consumer genetic testing maybe is not the best idea, or we see that in the context of biobanks, we don't give all the incidental findings to the patient or to the research participant directly. So I think it's worth even a separate project to ask what does it mean to empower patient in context of VHT? Does it mean only access to data, or does it always mean access to data? How to, I think that maybe both scientists and practitioners need some guidance to evidence-based solutions, how to empower the patients. More than half of respondents would like to learn more about scientific developments, and almost half claim that science is so complicated that they don't understand much about it. So we speak a lot about communication, but seems that we are still, there is a way ahead of us. Yeah, this is a question how to explain VHT. And yesterday, I think it was very fruitful discussion in the communication section, but still, so many people don't know what the virtual twin is. When I said it to some of my friends, I will go, and they are mostly in academia, by the way. I'm going to Amsterdam to discuss digital virtual twins. They asked, what's that? Even in academia. And then some details. Respondents see scientists mostly positively as intelligent, reliable, collaborative, and more. So nearly 4 in 10 also think that they are bad at communicating. That's how society sees scientists. In all member states, more respondents disagree that scientists spend sufficient time meeting people like them to explain their work than agree. So people would like to see scientists closer to them, if it's possible. But again, you see, I didn't point at that, but of course, in all cases, there are differences between member states, and sometimes bigger, sometimes smaller. So there is no one solution for every country. Maybe that's also a very important lesson when we speak about communication. We should look at our audience, starting from in which country we are. In 17 member states, at least half of the respondents agree that they would like to learn more about scientific developments, which is good. It means that more than half of European citizens are still very interested in science. And you can find your country and look how interested are your co-citizens. In 13 member states, more than half of respondents agree that science is so complicated that they don't understand much about it, with respondents in Benelux and northern member states most likely to disagree. So again, for example, Scandinavian Nordic countries have much better results in communicating science, meaning that maybe we have something to learn from them. And then, this is very important from my point of view, in all but 3 member states, 7 in 10 or more of respondents agree that science and technology should consider the needs of all people when developing new solutions and products. It was mentioned during the discussions in several occasions, but Still, I think we lack a systemic approach to how to address needs of different groups and how to ensure fair access to healthcare, also in the context of VHT, because it's not a secret that the way sometimes, the way how the research topics are chosen, it's not based maybe on data on groups which are most in need. It might be based on enthusiasm of the scientist, which is good, but then we have to balance enthusiasm of scientists with real needs of real groups. And yeah, I think also sometimes still the way how the calls are made, for example, for projects funded by European Commission, I know there are very good attempts, but still maybe it doesn't show or doesn't mirror the real needs, and some groups are left behind. Not to speak about white males as the data point for, but it was mentioned already. And another point is environment. Respondents show most interest in environmental problems, followed closely by the medical discoveries and new scientific discoveries and technological developments. I think this data shows that we can expect that more and more European citizens will ask what you do to minimize the environmental impact of your research. I was recently involved, there is New Horizon project, RE for Green, which deals with problems on science impact on environment. And I was shocked myself. I gave interview for this project, and I was shocked myself how little still, especially in biomedicine, we discuss the impact to environment. And big data, you mentioned all the computer systems, it's a threat for environment, of course. So this is my last slide. I don't have one solution, and I don't have solution better as included in European Code of Conduct for Research Integrity. I think we all together should use our moral compass and follow the ALIA principles. Be reliable, be honest. Yesterday we, by the way, discussed how to honestly communicate about science, be accountable, and show respect to all involved parties. That's it.
I think you can leave indeed the final slide of your presentation on the screen. Thank you for the presentation. I found it very interesting. Somebody from the communication background. I will turn to the audience for a question and see if someone has a comment they would like to share with us, or a question. Yes, on this side of the room. We'll take that question there, please.
Hi, thank you for a nice talk. I was just wondering, I think 1 or 2 slides before you showed the stated preferences of news topics, but I think a really interesting slide to put next to it would be some data from publishers and news agencies of the revealed preferences of the audience, because often they say they're very interested in science, but when you actually look what Google is pushing you, I think that we might have different preferences on what news to consume.
Yeah, but maybe even if you look at the real consumption of science news, then someone would say that maybe it's not what the audience expect, and you should change the science news or the way how you provide. It's never-ending story, of course. Yeah. Do you mean that people would like to show themselves better than they are, that they are interested in science and really they look for yellow pages or something like that? Maybe, but yeah, but it. I think if you can bring information in a way that the people, the society, or individual members can somehow connect with, and I think digital twin the metaphor itself, it's something where you can bring it very close to each individual, and then still the uptake of news might improve. But it's a very good question, of course.
It is indeed a good question. I mean, I'm drawn to think about, I wonder if the science of cat videos would get a lot of hits, perhaps given that society's addiction for some reason to cat videos. I have time for one last question, perhaps before we go to the panel, just on the outside here beside our camera person.
Thank you for your interesting presentation. There's one detail that struck me, that was that the Dutch disagreed with almost everything that was proposed to them. And that may be cultural, but the same went for the Czech and the Danish. Might there be some special effect going on? Mistranslation or?
But the Danish are very exceptional. There is a new Eurobarometer on digital decade. You can look at it. And for example, regarding the use or readiness to provide their data for scientific research, I remember Danish people were almost the best. Like UK was better. UK was a bit more than 50%, and then Netherlands was 44%. So maybe it's good that you are you do something good in the way how you communicate with society. Because society is quite ready to communicate, to collaborate with scientists. Maybe we can learn from Dutch. But of course, that's why I said that we should look what is data about different countries and try to learn what's done in a good way, why there are those, I would say, success stories. Dutch people are just exceptional.
And having lived here for more than 12 years, I can agree to that statement. Thank you for the question. Signia, thank you for your presentation. I'd invite you to come and sit in this chair at the very end on the panel. And at this moment, then, I'd like to bring the panel on stage with, first of all, Jolene, who's on there, her name already, and then followed by Rosanna as well, if you'd like to come on stage at this moment too. Marco and Frank also to come on stage. Let's give all of them a round of applause, please. So if you just take a seat as you walk on. Marco, I could put you here maybe, and then Frank, if you can sit here. Yeah, there we go. So we're going to start with short presentations from the 4 additional panelists. We'll start with Jolene. You can either give it standing at the podium or you can sit down, whichever option you prefer.
Oh,
and you have the clicker.
Yes.
The floor is yours.
Thank you. So, good afternoon, everybody. My name is Jolien Rovers. I work for the Department of Economy, Science and Innovation of the Flemish government. And Flanders is the northern region of Belgium. You can see on the slide some key figures. And in Belgium, the regions have the constitutional competence on research, innovation, and economic policy. And in Flanders, we invest quite a bit in research and development. So about 3% of our GDP expenditures go to research and development. And from the public side, more than 3 billion each year goes to science, technology, and innovation, and more than 2 billion to research and development. And usually, at the public level, we don't have thematic focus. I know this is different in different countries, but in Belgium, we usually use a bottom-up approach where scientists can submit proposals in calls, and excellence is the main selection criteria. And this has paid off because Flanders is considered innovation leader according to the Regional Innovation Scoreboard. So on this slide, you can see the technological specializations that we have in Flanders. And it's, if you look, we see the health sector being there, pharma, but also ICT, engineering, informatics, electronics, so very much related to everything related to virtual human twins. And then, yeah, this is just a slide to show the ecosystem in Flanders. We have, of course, universities, strategic research centers. We have cluster organizations from industry, incubators to help startups grow. We have infrastructure organizations present, and of course, access to funding. And then we also are very active in the European initiatives. I have put a few on the slide, but I will talk only about the ones relevant for the virtual human twins. So for example, the EPPERME, the European Partnership on Personalized Medicine, where we in Flanders are in the lead for the work package on accelerating innovation. So it's a partnership, a co-fund that gets top-up from the European Commission. So we organize yearly calls on personalized medicine topics for research and development. And next year also the first call will be made on a demonstration and innovation project, so higher TRL levels. So I think it's worthwhile to keep an eye out on these calls and see if you can submit proposals there. And then the second one is the Smart Health initiative of the Vanguard Initiative. So the pilot is an interregional collaboration. We have 13 regions so far, but we're open to new regions. So if you don't see your region on the slides and you are interested, feel free to contact us. So the idea is there to bring the regional ecosystems on smart health together to boost the implementation of personalized medicine and smart health across Europe. And the aim is to create investable interregional co-creation projects. So again, more the higher TRL levels. And we focus on 4 different pillars: data and digital technologies, converging technologies, preventive health, and sustainability of health. And under these pillars, we have several demo cases, and we're open to new demo cases. So again, if you feel like you have an idea for an interregional project on virtual human twin, we would very much welcome that. And I think that's my last slide. So I would like to thank you for your attention, and I look forward to the rest of the discussion.
Thank you very much, Jolene. Let's give Jolene a round of applause. The clicker is there, but I think, Rosanna, I think you're next. But just if you want to, I don't have the clicker in my hand. If you could maybe just click on the next slide. And it is Rosanna, yes, yeah.
Okay, thank you very much. I'm from AQUAS. AQUAS is the Agency of Quality and Assessment of Health in Catalonia. I'm Italian, as you can hear from my accent, but it's already 30 years already that I'm living there in Barcelona. This is AQUAS belongs to the Department of Health of Catalonia, and it is an HTA agency. But I'm not going to talk about HTA, so I'm not going to talk about health technology assessment. Why? Because what we are dedicated is to something different, not all AQUAS. AQUAS was born 30 years ago, no, dedicated HTA, but then one day they say, well, if we want to assess how we do, not only the technology, but how we do the health service, we need to start to measure. And so we started to create a common repository of all the health data citizens. And then we said, well, but if we see, because we are observing our health system, we have some bottlenecks, some issues, some problems, some needs that are unmet, maybe we need to start to think about how we can implement, how can we challenge the market to get solution of the challenges that we have, and then implement them. And so we started with a unit dedicated to, at that moment we were saying innovation procurement, and now we are saying value-based procurement, because it's not just incorporating innovation because we want to incorporate innovation, but because we want to bring value. So these are the projects that we started in 2012. There are some projects co-funded by different framework programs, FP7, the first one, the CIPHER, pre-commercial procurement. So we have several pre-commercial procurement, public procurement of innovation. One, for instance, called anti-superbugs in 2016, that is the father, and another one called RADAR, that is public procurement of innovation. So already in 2016, we saw an issue, a need, that we were already aware that the market and also us, so both market and us, were taking more than almost 10 years to be able to have a solution in place, have a solution available, and then to be able to implement it, to adopt it. So it's not just a matter of the industry, of the technology developers. It's a matter also of who is implementing it. And then we have also, in the last row, different projects dedicated to knowledge sharing, community of practices, and education programs. And also we have PPI, Public Procurement of Innovations, launched by the same payer in Catalonia, CatSalut. The payer did calls to ask the healthcare provider to identify their own challenges, to stimulate the market to address them through innovations. How we do it? Every time that we introduce an innovation, it is an intervention. So we start with defining the results we want to obtain, the outputs, the outcomes, and the impact. First, the impact, the long-term ones, no? How we impact our patients, our citizens, outputs. Then we look at our inputs, and then we decide the activities we need to develop. And we need to take into account all the stakeholders. Patients first, citizens first, in fact. Because if we want also to think about preventive medicine, citizens, or screening, citizens first. And then healthcare professionals, healthcare providers, health payer, and then why not social economic factors. And then this is enough. Well, this is a demand-driven process. Yes, this is enough, but it's not completely enough. We need also to talk with the market, because it's the market that will provide a solution, or the technology providers. And then we need to look at the risk we're going to take to make it happen. Is this ready to go? No, maybe it's a research development still. So the risk is a big one. We are not prepared yet, neither the technology providers, neither us. So what we need to do is take a big risk altogether, maybe pre-commercial procurement, that is a risk-benefit sharing approach. On the other side, we have already evidence. We know that it works. It's a product with a medical device we know that it's safe and have demonstrated clinical effectiveness. So maybe we can go with the public procurement of innovation. And then this was another one that I cannot go because I already... okay, thank you. So the last one. If this is a framework, evaluation framework put together for a personalized medicine project in cancer, where we're saying that every time we do from something that is identification of the unmet needs to the proof of concept, we are in level 1. Then, once we have ready to go to the implemented in one healthcare provider or more, but from different systems, to one health system implementation, we are in level 2. And then when we can go, because we have demonstrated the evidence, we know the results, we can go to more than one system, we are in level 3. So we are scaling up across Europe. We are doing it together with NKI, Netherlands Cancer Institute, and the Fisabio, the equity unit in cancer of Fisabio. That's all. Thank you very much.
Thank you very much. I will hand over to Frank for the next panelist presentation.
Thanks. So I don't have any slides, just a short introduction about myself. Actually, 3 roles that I want to zoom in. So firstly, I'm representing AMDEX, which is a collaboration within the Netherlands, fully focused on building a trustworthy data exchange with a specific focus on what we call the automation of agreements between the parties involved on this data exchange, as well as all sorts of regulatory requirements. So we are actually trying to build an ecosystem that is by design compliant, so to say. It sounded like an applause, but it's a bit too soon maybe. And with this collaboration, it's also AMSIC, so the Amsterdam Internet Exchange, the University of Amsterdam, SURF, actually also represented by Marco, DEXIS, and the Amsterdam Economic Board. We are trying to build such a platform. And then that's also the second topic that I want to discuss shortly is what we call DMI. It's a project that we are currently working on. It stands for Dutch, difficult word, Metropolitan innovation, and it's actually a project funded by the Dutch government from the Nationaal Groeifonds, the National Growth Fund. It was actually killed after the new government here, but we still were able to find some funding. And there what we are trying to do is for specifically municipalities, cities, we're trying to also build a platform that they can share their data. And we are responsible to build the, let's say, governance layer. And that governance layer is actually has the intention to define roles and responsibilities on the platform, and also automate those contractual agreements and the regulatory requirements as much as possible in the platform itself. And there's some specific audit knowledge required for that as well, and that's actually my role within KPMG. I'm leading the responsible AI team, and actually we are auditing AI systems for our clients on demand. But I also have a background as an IT auditor, which means reviewing IT systems to make sure that they are doing what they are supposed to do and that they are controlled in a right way within the organization. And that audit knowledge is also required to build those platforms, because we believe that even though the platform itself can be trustworthy, there can still be some misuse of the organizations actually working on using the platform. And we believe that an audit functionality is also required to make that platform fully trustworthy. So with KPMG, we're bringing in that knowledge from how to audit those type of systems to make sure that the entire platform is trustworthy. So that's a bit of my roles currently, and I'm also looking very much forward to the panel.
Thank you very much, Frank. And finally, Marco.
Yeah, so good afternoon, everyone. First of all, I would like to thank the organizer of this meeting for inviting us and giving us the opportunity also to present the work that we do at SURF. Yeah, in these 5 minutes, I'll try to give you, I'll shift a little bit the focus more on from the health platform and policies to the infrastructure. And I'll try to give you an overview of what we do at SURF and why we are interested in this kind of development and services and platform. First of all, SURF is an ICT cooperative association of Dutch research and educational institution, and we work together to develop ICT services to improve research and education, specifically in the Netherlands. What we do actually, it covers different areas. From one side, we maintain, provision, and provide access to our different type of research infrastructure, cloud, high-performance computing, storage, and so on. We also provide support to our user to efficiently use, access, and produce science with this infrastructure. And we work also on development of services on top of these platforms. A lot of our work is also focused on knowledge exchange, knowledge sharing. So from one side, the trainings, specific ICT trainings, but also collaboration with members in more domain-specific trainings, AI or science, computer science trainings, but also workshop, best practices, collaboration of this type. And very important for us is also collaboration within the Netherlands and also at the European level to integrate and develop new services. And this is especially important for us because what we've seen, especially in computer science, ICT-related research, is that nowadays research is it's far more than just a big system. So as the collaboration grows, as the problem grows, the collaboration grows, the data set will grow, the requirement in terms of compute power, the integration grows. So for really providing an infrastructure for today's research, we need to think of a complete ecosystem that goes from expertise to software, to workflow, to integration methods, and the infrastructure itself. And this is what we try to look at SURF. So these slides provide like very generic overview of what we call infrastructure ecosystem at SURF. So you can see in the center the resources that we provide access. So as I said, high performance computing, high throughput computing, storage, networking. We look also more cutting edge technology like quantum computing, neuromorphic computing. And around this, we do not only provide access to these services, but we look also at concepts like security, sustainability. I heard before the concept of sustainability also in IT, identity management, and also all expertise up to advise our user with one technology or the other, work together to develop new workflow applications. As I said, also consulting, domain-specific, machine learning, extended reality, and all part of also visualization in science that's very important. On the other side, as I said, we have quite a lot of collaboration nationally and also internationally, and we try to integrate, especially on the aspect of the resource access and management, from the Tier 2 centers, national Tier 2 centers, up to the European level organization like the EuroHPC, Exascale project, EOSC, but also working very closely with the commercial cloud provider that can have like completely different scale from local and regional cloud systems. So as a last slide, I wanted to give just few idea of projects that can be important or related to the work we're doing today, to the VHT. Especially in the part of providing service, compute and data services for health and medicine related project. We've been hearing already a lot about the Altera initiative in the Netherlands. Surf is part of it and active member. From other side, we have looked also more in high-performance computing biomedical simulations, so not only machine learning and data-driven simulation, but also high-performance computing in the CombioMed project. And for example, we worked also on building portal for accessing, managing data, sharing data, like the Alzheimer Genetic Hub that has been a collaboration between VU and SURF. Lastly, I wanted just to highlight one of the projects we have been working at SURF that although it does not involve health-related data, it's something very important, especially when we think of a virtual human technology, that is the processing on sensitive data. So I've been working in this project in collaboration with a Dutch organization called Odyssey to have an isolated system on the national supercomputer where researchers were able to process data with a highly sensitive standard. Data coming from the Central Bureau of Statistics of the Netherlands. With a special connection, they were able to process and analyze this data on the Snellius supercomputer, that is the Dutch supercomputer. And we're looking forward to try to integrate this kind of services also in other environments like the VHT. And with this, thank you.
Thank you very much, Marco. You can take a seat once again. You can leave it there. And you've put on the perfect slide. That's exactly what I want on the screen for the discussion. Thank you, everyone, for your opening words, and of course to Signia for the opening keynote. I want to ask a question, just a fun question at the start, motivated by the second question I received from the audience. We have a very international panel, and I think you have seen either the country that you were based in or the country you're from on many of the survey questions that Signia showed us in the presentation. I know I was looking at Ireland all the time to see where Ireland was. Was there any one result that really stood out for you, depending on where you're from or where you're working at the moment, you thought, wow, I did not expect that? Rosanna, the microphone is on the chair.
Yes, I'm not surprised. I think one of the also, maybe we should, I don't know, maybe we should study it, but maybe one slide could be also the level of technology, alphabetization of the country. And maybe we discovered that in the northern country they are more alphabetized digitally than in the southern of Europe. So, and this is already create a day-by-day way to live that also then supports you in maybe understanding better or already not understanding better the technology, but already putting you already in front of the technology in a different way. If you are used, then maybe you don't make some question to yourself. If you are not so used, maybe you start to make some question to yourself. So it's not just a matter of education. I think it's also a matter of how much the digital services are available to you.
Okay, thank you, Rosanna. Marco, from your perspective.
Yeah, so I wasn't really surprised by any country in particular, but there was one slide showing quite diffuse, a lot of people saying that they think science is too complicated, to access information are too complicated. And I think that is an aspect where we could work, especially in thinking about platform or ecosystem like the VHT, from the beginning. So I'm talking from technological point of view. I'm not a policymaker, not expert of health policies. But I think from the technological point of view, we can do a lot in making data more accessible with graphical user interfaces, with 3D visualization that can help patient and citizen understanding better in a simpler way what they've been fed from doctor or scientists. And this is something that we can already do. It's not science fiction. We have already a lot of development also in scientific visualization, graphical user interface, and making, I think, the citizen more active part of this, being able also to consult their own, in this case, health data from all the chain of processing of this data from the data acquisition to the doctor, with user interfaces that can help them in understanding or getting used to this data. I think we can reduce a lot the gap of people saying, no, science is too difficult for me, I don't want to even know what it is. So it's not just informing them, it's also giving them tools to actively feel active part of this process.
Frank, how about you? How did you see those questions and answers that were shared?
I was trying to dodge this question, but...
Good job.
Because I didn't really pay attention, only focus on the Netherlands. But what I can say actually on this, I think more generically. So in the Netherlands, we've seen actually quite some big things happening at the government where they used at least data, technology, at least that's what people think, for specific purposes. In this case, looking for fraud in childcare benefits. And for the people from the Netherlands, they know it, the toeslagenaffaire. But what it actually did is they were way too harsh towards citizens having kids, taking them to childcare, and then you can get benefits to, let's say, make it a bit more easy on your wallet. And then they identified all those people on fraud, which weren't fraud people. And then big things happened because they were, everything were taken away pretty much because it was way too harsh there. And then there's let's say, an atmosphere around it that was due to data, technology, perhaps even AI being used by those governments to identify those frauds. And that doesn't help, I think, in the trustworthiness of those systems. So I think generically put, if you have those, let's say, big incidents in a country or at an organization, a government organization, then that causes trust issues, so to say. So you need to be aware of those, let's say, happening. That was a bit of the generic thought that I had based on trustworthiness in technology, science, and those kind of things.
And I do know someone who was affected by this.
It's quite impactful, yeah.
Absolutely. Jolene, how about from your perspective?
Well, I looked at the Belgian perspective, of course.
Of course.
And I was actually a bit surprised to see that the Benelux and the Nordic regions, countries were doing so well with regards to how they do the science communication and the trust. I was not aware of that. I know that we have a policy program on science communication, some budget available for science communicators to go to science festivals, to have the podcasts, all these this kind of initiatives to make science accessible, very light-hearted, like informing the general public, but in a fun way or in an engaging way. We also have a lot of campaigns from the government to stimulate, for example, science education for women or for people from minorities, to make sure that we use all the potential that we have in Belgium and in Flanders to go to a scientific education if they feel like it. So that's things that popped up in my mind when I read about it, when I heard about it. But yeah, I still wonder if there are other things that that contribute or are different from the other countries.
And that's why I'm going to come to you for the last reaction here on this thing. You're the one who presented the data, so you've read that report very well. It's the first time I've ever seen the data set, and I found it very interesting. In your opinion, what lessons can be learned from such a data set when it comes to an initiative like the VHT moving forward? You did have an open question in your presentation in relation to that.
Yeah, I think two issues were the most surprising for me. One was about these power relationships, because I still was surprised that so many citizens see scientists as holding some kind of power. Maybe there was some influence of COVID situation, because in COVID there were these power relationships and discussions, but still it was very important for me, and I think in VHT project, if there could be any really evidence-based solutions for empowering, that would be very important from my point of view. Anything related to health literacy, how the interface might increase health literacy in very different types of users. And not only patients, by the way, now there is a lot of talk about organizational health literacy, so how organizations can increase health literacy in their environments. Yeah, and also how patients can be empowered, but at the same time not harmed. So how to keep this balance. And the second was environment. I think VHT might maybe collaborate with some kind of environmental scientists and discuss in depth how to decrease potential influence on environment.
Yeah, and we had indeed in the last panel comment in relation to taking into account other data sets in relation to that are outside the traditional healthcare data. Let me come to the audience then and ask for a question. I have two questions. I'm going to get both. Sagar, you can go first, and then I'll take a question from this person at the back then after that. Sagar, the floor is yours.
Thank you. Thank you for the nice panel, and thank you for the presentations. It was very nice. I have a question which is a bit more paradoxical, or I think operates in a dichotomy. So bringing virtual human twin as a concept to society, I think is, at least in the conversation in these 2 days, relies heavily on adoption of the market as well. So of these technologies, but the market as well. I think there's a strong emphasis on that some of the market parties or entities will adopt some of these components, and then they will try to bring it to a general audience and public. My question is, are we not relying too much on market to deliver the VHT capabilities to patients who might need care? Because on one side we are asking patients on consent of data, but on other side it's also that if patient would like to benefit from such a VHT, there might be a lot of difference, or they're a bit also further away from benefiting from the VHT itself. And how do we rely on the market itself, which is still stuck in the growth paradigm? So I think market also sees VHT as a growth paradigm rather than as a care paradigm.
Rosanna, I saw you moving your microphone, yes.
Okay, to me,
yep,
is it work? Yeah. Okay. To me, really, as I was explaining, is a demand-driven process. So it's not the market. It is the public administration, the public hospital. Well, if we want to go to the public, if we want to go to the private, is another sector. But if we want to go to the public world, is public administration that identifies unmet needs internally, and this identification. And this is a word that is key for us, but also was mentioned in the previous panel, the word implementation. So not everything fits everywhere. So I need to understand my needs, my unmet needs. If I don't address my unmet needs from 5 years now, what happens? if I do have enough physicians, do I have enough GPs, do I have enough educated healthcare force, or do I need patients to empower themselves because unfortunately they are in a remote area and I cannot have them every day come to my GP. All of these elements need to be taken into account. So the technology really, a pure technology push in this case, I'm sorry, this is my point of view, is not fully working, but because still we are not prepared. Again, you as a healthcare provider, as a technology provider, us as a future implementer, we need to work together to understand what are the patient needs, the patient experience, the health professional experience, and then at the end, what is the cost opportunity? That is how to make this implementation and adoption viable. It's not that we have a bunch of money to spend. No, we have already money that we are buying healthcare services, and if we need to introduce innovation, what does it mean? How does it change the patient workflow? How does it change the healthcare provider workflow, the healthcare professional workflow? This is what needs to be done, and this is what we are doing with several innovations, several research and development. And this is one of them. And yes, before to go to be implemented, adopted on site, we need to be certified. We cannot implement anything if it doesn't have any CE mark. That's clear.
Would anyone else like to comment on this? Everyone has their own microphone. Marco, do you want to comment on this?
Yeah, no. I'm not an expert really of the marketing part of this, of course. I think one of the good things of this initiative is that, as you said, Rosanna, it's very much interest of institutions, of healthcare providers, national healthcare providers. So I think before looking at the market option, that's also quite big, because if you think also medical devices and all that market there, they are already using these technologies actively. I think before looking at the market benefit or the commercialization of the technology, we need to look at the benefit they can bring to the citizen. And as Rosanna was saying, we need to improve in the confidence on the results that we provide, reproducibility, and give like more access to these technologies. And although I agree with you saying that everyone has his own problems and we need to solve specific questions, I also believe that from the beginning it's good to look into interoperability of these tools, that not every country develop their own solutions because they have their own particular political or policy situation. We need to think about interoperability from the beginning. And just one last remark that I see, like maybe this is a trend also very much in research, but I think it is pushing also in the right way when we think about the competition between market and open public research. Is also that I see more and more a shift towards more open science tools, whether instead of commercial tools like in the past. And this brings also more like, possibilities to develop this solution in a public space without being confined by the market and business opportunities, let's say.
Frank, you were nodding your head a little bit there.
No, I was just thinking, I think it's just a given that there is a market, right? So again, focusing on the Netherlands, they have major power, the insurance companies, right? So we have 4 large insurance companies, and they keep an eye on the Dutch healthcare market, some sort of say. And they have quite some power, actually. They make it very cost efficient. I think in the Netherlands we also have a relatively cost efficient healthcare system, which is also to the right level. And I think it's, and maybe that's also because of my background in KPMG, I think it's fair to say that those solutions only will be adopted if they bring the added value that's also from an economic perspective worth it, so to say. So I can think of a way how the market cannot be involved. It's just a given from my point of view.
Signia, for you?
I have some experience with access to medicines and marketing of medicines, and I think there are many lessons we can learn from that field. And I think it's a very good question, and we should take care that market and marketing doesn't influence the uptake of VHT in negative way. Like I think what I showed about groups feeling that they are not reached out by science or technologies, and we see in access to medicines that there are rare diseases, there are other neglected diseases, and industry and market are not interested in them. And in my view, it's very important not to repeat those mistakes, and somehow from the beginning pay attention to those groups which might be somehow let aside otherwise.
Thank you. And Jolene, I'll come to you for a final comment on this question.
Thank you. I would like to agree mostly with what I said. I would like to add the point of maybe the collaboration between private and public partners, so the public-private partnerships, that can help to bring together the different players to develop the solutions that are needed. Because from the market point of view, of course, they also want to know what the end users' needs are, and this can benefit. And also to use pre-commercial procurements to make sure that developments that are needed, the unmet needs are being addressed.
Thank you very much. Thank you for the question. I'll go to your question.
So my name is Steve Burke, and I'm an advocate for people who are patients and empowering them in health innovation. In the interest of time, as you might say, Barry, I'm not going to get into the conversation around empowerment, but I have a lot of ideas in that regard. My question goes towards an area that I haven't really heard a discussion around, and that's about the legacy value of my virtual human twin. So my twin will outlive me, and it will go forward. And it will go forward to invest in my personal, which will be my direct family. It will go forward to the community, i.e. the community of lived experience that I have. And it will go forward to the societal value. I'd like each of our panel members to give us maybe one opportunity, one challenge with that legacy, and if they have a challenge to a solution that they might see to address that.
That question really sounds like you're talking about a future of Uploaded, if you've ever seen that series on Amazon Prime, effectively, in a way. But I'd be very interested to hear how you all react to that, yeah. You're all thinking now, aren't you? Legacy. Rosanna, what do you think?
If I want, I can start. About the... just one thing about the empowerment. Empowerment, to me, is to have, that also was said in the previous panel, that the patient is able to decide with the physician about his health status. So take a decision on his health status. And so maybe why I'm saying this, because maybe this is also empowering you about, who knows, if we want to have a legacy of our virtual twin or not. Maybe it's something that we should decide, if when we die, our virtual twin dies with us or not. And clearly, it is a benefit to all the society if we can keep virtual twins also beyond us, because this will enrich maybe aspects in the data, the challenges maybe we are going to face, and that we repeat in the history, and we and we have lost somehow the memory with our current healthcare professional. But thanks to the virtual twin, we can repeat what happened, and also we can simulate then what is the best way to face this challenge. So to me, if we could decide the opt-in and the opt-out about the virtual twin would be the best, but also there are clearly beneficial to keep them.
Okay. Does anyone else share the optimism in terms of retaining your digital twin long after your real self has left?
Yeah, no, if I may add, like also I'm putting my techie hat on, and so I really like the idea of the legacy of your data. I'm not commenting, I really like the idea, the philosophical idea of leaving behind your own data. There is also all the implementation and technical point, the advantages of having historical data to be able, for example, now that we live in this AI world, to retrain model, to revalidate model. Also validation is a great part that can bring added value having legacy data. The important thing is that we are already exploding with data. We need to be careful what we want to keep as a legacy. It's not that easy. There are already plenty of discussion now. What are the data that are relevant for certain simulations, certain analyses? If we start thinking also legacy data, we need to start thinking of infrastructure able to host this data, data management tools or procedure to able to correctly label, give metadata, and extract the meaningful information out of that. So this is like the challenge I see from technological point of view. But again, the advantages are, plenty. And philosophically, the idea is beautiful of leaving behind your virtual copy.
Jolene, how about you? What do you think?
I would like to add the ethical point of view, like you said, how your data can be relevant for your family members, and how they can make different choices on if they want to know this data, if they want to, how they will use this data. And I think it's very important to have this discussion and to just make very clear boundaries, like, for example, your health data cannot be accessed by insurers, and like that we can, well, have to decide how to do it, but make some kind of regulation on for which purposes the health data can be used, if it can be also used for relatives, if it can be used after you died, can it be reused in an anonymous way, or can it be still linked to who you were, all these kind of ethical discussions, basically. I don't have clear solutions, but I think it's very important to think of those aspects as well when developing the regulation.
Frank, you're working on a project with lots of data at the moment, right?
So, but I was actually thinking about the same issue as Jolien was referring to. So I already mentioned the insurance companies. So if they get access to that data, for example, they can calculate their premium based on your parent, for example, and then they say, oh, you have a high chance on this disease because your relative was also impacted by that disease. So if that's becoming the case, then it would be quite impactful for the people left behind.
But, but I would assume the insurance companies would look forward a little bit. You know, they wouldn't be looking at like generations before, when food was different, medicine was different, society was different, and they'd look at what's happening now to a similar cohort.
Yeah, but you have certain. I don't know. I'm not a doctor, but I can imagine that if you that there are some diseases, for example, that are more likely if your parent had it as well. So I can imagine that if they are looking for those ones, that it could be also quite negative for the ones left behind.
Yeah. And just in your own, because you mentioned a few minutes ago about your own project, I assume the one that you're talking about, the DMI, which I won't ask you to pronounce again in English, so you don't get tongue twisted, but you're going to process a lot of data in that project, right?
Yeah.
So what's your legacy with that data? What's your legacy plan with that?
We just started 6 months ago, so I don't have a real answer to that yet. No, unfortunately. And it's like a big project, right? So we're not the only party involved. It's like 30 parties or something. So we're not doing the data part.
Can I ask you very quickly, what would your idealized legacy data plan then be? for that project. For that project, what would be, in your viewpoint, a good legacy plan to have for the data in that project? Or does this come back to you later? Question.
Yeah. I haven't really thought this through, to be honest. No. The good legacy data. So it's just building the platform where, for example, municipalities are able to share their data. And if it just benefits cities in optimizing, I don't know, traffic within a, or also from a sustainability perspective, then I'm already fully happy with the result, and I don't really mind what happens to the data.
You don't mind what
afterwards.
happens after that then? One last comment then on this question, and then we will conclude. Unfortunately, we have to run out of time.
One thing, really, there are discussions in literature on this issue. It's not, it's at least mentioned. Second, there is an easy answer, and easy answer is autonomy and informed consent. So, but it means that we should include in informed consent information about that, and that's something which is important. If we don't ask at one point, we cannot know what the person thinks about. And the second thing, we have to explain what does it mean, which is not easy, I think. And not an easy answer is, by the way, I'm all the time wondering who invented the metaphor of twin for in this context, because I think it's a very powerful metaphor, and we know that metaphors work on our thinking, and I think that it's a very good metaphor, but in some sense it might be misleading by giving this message of what's that? That's my twin, so I can leave my twin to my, I don't know, family in the future. So it should be very carefully chosen how to explain what does it mean, digital twin. And I think there is a long way ahead.
So the definition of what a digital twin is will affect exactly what the definition of a legacy is.
Yeah, but still this metaphor itself, it's very, very powerful. And you can choose different metaphor, and someone chose this one. And it will be interesting for history of science, why and who chose it.
Maybe the person is in the room who picked that. Or maybe not, in that sense. Thank you for the very nice question to allow us to jump into that. Unfortunately, we've run out of time with the discussion. Let's give our panelists a very warm round of applause.